Welcome to the Lifescript Podcast. I'm your host, Dr Sonu. The Lifescript Podcast is on a mission to uncover what health truly means and give insight into my unique, evidence-based health philosophy I call your Lifescript. The Lifescript Podcast aims to empower you with thought-provoking discussions with leading medical professionals and wellness experts and how it ties into your Lifescript. Together, we discuss the rapid rise of chronic diseases and mental health conditions and how our lifestyle, our emotional health, and the core medicine all intertwines to give you the best health for life. Please be aware that this podcast is not intended to diagnose, treat, or provide individualized medical advice for any health conditions. If you're seeking tailored support, you can explore more on my website, drsonu.com.au. That's drsonu.com.au. I hope you enjoy this episode. Hi, welcome to Your Lifescript. It is my great pleasure to invite my guest today, Dr. Pamela Weir, who's been an eye surgeon for a very long time. That's how she asked me to introduce herself. But welcome, Pam, and it's my pleasure to have you on my podcast. And today we're going to talk about a very important topic that we promised our viewers on our last show. So we're going to talk about the diabetic eye, the dreaded diabetic eye. I think anyone who's had diabetes or bad diabetes, their biggest fear is to be blind or, have something wrong with the eye. It's something that I get scared of in general practice. Is anything to do with the eye? I'm like, okay, you're going to go see someone like you. So it's scary for people, to have something wrong with their eyes. And diabetes is such a cruel disease.
Yes.
And so tell us about what happens in diabetes with the eye. How is that also a window into what's happening in our body, in our whole system, all our blood vessels? So very excited to hear your expertise.
Okay, so with diabetic eye disease, we really have two groups. We have type 1 diabetics, which really, they have an autoimmune disease. And this often occurs at a reasonably young age, even in childhood, teenager years, they become rapidly sick and completely dependent on insulin. And once type 1 diabetics get to puberty, this is when they can start to develop eye disease. So we usually screen type 1 diabetics from puberty every year. Now, the other much larger group of diabetics are the type 2 diabetics, who are really becoming insensitive to insulin. Yes, a lot of them have a genetic tendency, but this is aggravated by environmental factors, which by and large is obesity. The type 2 diabetics, there are a lot more of type 2 diabetics, and both groups come to us to be screened for eye disease. Now, the interesting thing in ophthalmology is we have a window into people's vascular system. It's the only part of the body where we can look directly at blood vessels, and we can see lots of things from those blood vessels. We can see if someone has been hypertensive for a long time.
So high blood pressure.
So high blood pressure, the arteries start to become hardened, and we see that as something we call silver wiring. And also where the arteries cross over veins, the hard artery can squash the vein, almost like you've put your foot on a hose in the garden. So that can cause problems too. In diabetics, they have a problem where the the strengthening in the walls of their capillaries starts to break down.
These are the little blood vessels.
That's right. So capillaries are the tiny little blood vessels that actually do all the supplying of oxygen to your tissues. And so as the capillary vessel wall breaks down, you get little outpouchings, which are called microaneurysms. And we can see those in the back of a diabetic's eye as they start to get what we call diabetic retinopathy. And eventually those little capillaries die off. And once that happens, then all hell can break loose in a diabetic's eye. Unfortunately, they're often not aware of these changes occurring, which is why they have to be screened on a regular basis. The longer they have diabetes for, the more likely they are to get retinopathy. The poorer their control, the more likely they're going to get retinopathy. And if you add those two together, poor control, having diabetes for a long time, then they're guaranteed to have retinopathy. I think the good thing with diabetic eye disease is it is actually reversible. Obviously you can't control how long you've had diabetes for, but you can certainly control how well your blood sugars are maintained. And that's becoming easier with technology now. Sonu, you would know quite a bit about insulin pumps and all the other mechanisms we now have.
But that's the type 1s though.
Well, for type 2s, they can still monitor their blood sugars with the little gadgets that they stick on their arm. And that actually links to their mobile phone. So over a period of 2 weeks, they can see what their blood sugars are doing during that period. They can keep a log of what they're eating and drinking, and then marry the two, and then try to start improving that situation. I think a lot of the diabetics I see who have eye disease really don't understand their condition. They know they have to take a pill every day. Sometimes they need to take a little bit of insulin at night. But they don't really understand that a lot of their lifestyle is actually causing their diabetes or aggravating it.
Yeah. No, it's interesting, isn't it, that we know as clinicians that if they changed how they lived or ate, then they could be so much better. And you would have seen that in practice. Those that are able to do that, get onto the gadgets, get inspired, get, really in control of their own health and well-being. And then there are those that, just carry on the same path, waiting for the next bad thing to happen. So really when you look at someone's eye, you have, what we're talking about is looking at the back of the eye through through the pupil. And, we used to do that with a little gadget called an ophthalmoscope in med school. Most of us couldn't see the back of the eye that properly, but now we have such beautiful, gadgets and cameras that you can get
amazing technology now. And we have technology now called OCT, which actually will show the 11 layers of the retina, which is the back of the eye, which is, if you think of a film in a camera, that's what the retina does. It's actually the film in the camera. Yeah. So you don't want any smudges on that film. So you want to maintain that in a nice, healthy state.
Would you say that the quality of our retina is kind of representative of the quality of your vascular system? Because the vascular system...
Well, that's right.
What controls our brain, our risk of dementia, what controls our heart, our kidneys, our everything.
And this is something that always surprises me with diabetic patients. They're not aware that when they start to have problems in the back of their eyes, this is happening throughout their body.
Yeah.
And you have to explain that to them. They also don't always seem to link the fact that they're overweight with their diabetes. And, especially men, they sit there and they look 9 months pregnant, but it's just like it's fat. And they, you have to point that out to them and say, look, what are you doing about that?
Yeah.
Because this is why you can't control your diabetes.
Yeah.
And, if you get rid of that and get your weight down, you may not get rid of your diabetes completely, but it will be so much better. And then the back of your eyes can start to heal. And they do heal. And I've got patients I've followed for 20, 25 years where they've come into me, they've got severe diabetic eye disease, they've already lost quite a bit of vision. And I start them on the journey of correcting the issues in their eyes. And I talk to them about losing weight, getting fit, and trying to control their blood sugars in a more normal way. And some patients you win, and they will actually do that. And over a period of time, you can see the diabetic retinopathy where all the blood vessels are leaking and doing all things they shouldn't do. And you gradually watch that improve over a period of years. And it's fascinating to see that.
And when you show it to them, they feel so good about that. Because people want to see results. We're creatures. We want to be rewarded for our good work. So it's fascinating. So, and I think people don't understand. We have a culture where you can go to the optometrist and they'll check your eye. But I think the importance of seeing a specialist like yourself early on to get a window into their vascular system and having that insight that they can actually change the trajectory of their disease, I think is really important. And, we do our jobs with the idea of not to be, to give the best information. We're not there to not say the hard things. And I think that's really important. And I think lifestyle is so important. And that's why, when we talk about the life wheel, yes, the core medicine, what you and I do, the pills we prescribe, the procedures we do, you can laser the back of the eye if there's a leaky vessel, you do so many amazing things with what you can do to fix. But it all still comes down to patchworking the effect of a problem rather than fix the cause or the trajectory of the problem.
That's right.
And I think this is the core focus of this podcast and, this whole conversation is that, yes, while all that is important, we can't ignore the real issues, the cause. And I think when all the clinicians speak from the same page, so that diabetic man reaches your room, and I know you're one of those clinicians that will point out that they're overweight and they should do something about it. And yes, not everyone will listen, but there will be a few, and it's worth those few to, make it your habit to motivate. So that's really interesting. The other thing I feel is what people don't realize is that bad lifestyle doesn't only cause diabetes. It causes blood pressure, it causes sleep apnea, it causes heart disease, it causes so many things. It's like all the friends come to party, at your expense. So I always say to them, and for each you have a new pill. And each pill has 5 side effects.
And then if you add a few pills in together,
you get another party happening in your gut. So, and being physicians, we prescribe these things and they have a place and they're important. But we also know that with lifestyle, we say the opposite. You lose weight, it will have no side effects. It will have 5 positive effects.
Exactly.
Not only will your diabetes get better, your blood pressure will get better, your heart disease will get better, you will sleep better, your marriage will probably be saved, rather than saying, well, this is the list of all the side effects you could potentially get. And I think more and more in my career, I'm being inspired by one, living that philosophy. We're all aging is something we can't reverse or change, but we can age well. We can age better. So I think it's really great to hear from you that when you see that, and over 25 years you see the change. And that sort of brings me to the point which I'd like you to again tell us from your experience and expertise, is that body's ability to heal and reverse things, like the same blood vessel that's hardened.
Quite amazing. And even with diabetic eye disease, I can think of one patient in particular who, when he first came to see me, he had the big gut, and the back of his eyes just looked like a bomb had gone off. And I spoke to him for quite a while about the things he could do. I said, I can help, but at the end of the day, you're responsible for your health. And I think that perhaps modern medicine has allowed patients to hand that responsibility to the doctor, which is totally wrong, because we can patch things up with pills and Band-Aids, but at the end of the day, people have to take responsibility for themselves.
Yeah.
And, the information is readily available on how to lose weight and how to live a better life. You can Google it. You can Google anything you need. How to do exercise, you can Google it. So there's plenty of information out there. But really, I think people are lazy. They're lazy to do it. Or it's taking that first step.
And like you said, we've created, do you think we've created a dependent that, we have a problem, I'm diabetic now, I need to see my eye specialist 100%. And my endocrinologist and my cardiologist and my GP, and I'm on...
And then they're on the medical merry-go-round of just going from specialist to GP, round and round and round. And in some ways, I think people can even derive pleasure from that. They can go down to the bowls club and say, I've got to see this specialist this week and this specialist this... People need to step back from the whole doctoring thing and start to be responsible for their health. Because a lot of Western disease is self-inflicted. It really is.
Yeah.
And we're just patching it up.
Yeah.
Especially as a GP, you would know that.
Yeah.
You're forever just patching it up with a prescription or this, that, or the other.
Yeah, no, I often say that, and that's why, my passion for looking beyond the pill and beyond that referral. I said, I'm not a clerk. I'm not here to just write your referral because you need to see Pam and give you your 5 diabetic medication. I'm here so that you can live the best life. I'm here so you don't get dementia. I often say in patients, it hits home though. I say, I don't want you to be doubly incontinent in a nappy, not knowing where you are and not being able to wipe your bottom,
Yeah, exactly.
And we are meant to age well. And the only thing that will change you going on getting there is what you choose to do with your lifestyle. And the way you will choose to change your lifestyle is how you will change your thinking and your mindset, your why. So it's interesting. And I think when I speak to clinicians like you, when I speak to, I was speaking to one of the oncologists, the cancer specialist who treats all the women's cancers. And I said to him, what is the most often said thing in your consulting room? What do you say? Like, we know that. We say the same thing. Sometimes I think I'm repeating myself. I could record this and say it again, And you kind of get the same kind of patients in a single day. Don't you get that? Like, sometimes it's all with mental health or all with some kind of urine infection, or, it comes in groups somehow. But anyway, the point I was making is that when I asked this oncologist, what is the single most thing you say most often in your rooms? And, to my surprise, he said, lose weight.
Because obesity is associated with, it's carcinogenic. It causes cancer.
And, we talk about inflammation, gut health, and all of that. So, the idea is to with experts like you who see the real disease, who are there to hold that baton. And I will talk a bit about that, because I think that's a very interesting concept. Somewhere I feel in my, 2 decades of my career, there is that shift. We've kind of lost that listening, that communication to patients. It's happened both ways, I guess. And I try very hard to preserve that. To really listen carefully, what's important to them, because only then I can turn the key in their head. It's not just naming and shaming to say you're fat, go lose weight. It's a bit more than that. Like, I see you, I hear you, I want you to be here, and this is what you need to do. So tell me, in your career, and you've worked in northern New South Wales, you've run a big practice there, you've worked in the town here on the Gold Coast, and you've seen, without filters, tell me what you think, how the patients receptivity to information and expectations have changed as you have witnessed through your career, and possibly how can we make it better? Because what we're saying, this got to change. We're sitting on a obesity crisis, chronic disease crisis, and you and I are saying we've got to change how we live.
Well, I think my initial practice was really in rural Australia, and most of the patients I saw were normal sized farmers, people who exercise by virtue of their job.
Yeah.
And then the shift has really, in the last 10 years, as you know, there's been a big shift on social media to accept obesity as something that's normal. And that's been normalised with some of the big fitness companies. Nike are now using people as models who are actually obese because they want to normalise that appearance. And I think that's not good for everyone. I understand why they've done it, but I would like us to shift back to the old days where it wasn't normal to be obese, and obese people were actually rare. There wasn't the access to food that we have now. We don't even have to cook now. We just dial up Uber Eats on the phone and it arrives. You look at the number of people who eat out, and a lot of people eat out every night. They're eating takeaway. And the problem with that sort of food is you have no control over what you're actually eating. And I'm not saying you should never eat out or never have takeaway. We all do. But you shouldn't be doing it 3, 4, 5, 7 nights a week. And I think that a lot of people don't know how to cook. Just how to cook from basic ingredients. They don't know how to shop. They don't know how to go and buy vegetables and turn those vegetables into a meal. So we're losing a lot of life skills because now you're getting into generations where there's never been any cooking. So that's not being handed down.
Yeah.
And there's no problem finding out how to cook. You can look at YouTube and Google and get recipes and all of those things. But I think there's something about learning to cook directly from a family member, mom or dad or brother, sister or someone, And also I think when you're cooking in the kitchen, you know, kids like to hang around and check out what you're doing. That's very important.
And I think, you know, the respect for food, where it's come from, cooking it yourself, you're going to have more respect for it. Yes. You're going to relish the taste. You're not going to eat it fast. You're going to look at it, appreciate it. You're not going to eat it while you're watching, you know, something on TV. And I remember growing up, you know, waiting for the whistle of the pressure cooker and the sizzle of the garnish on the khichdi, and, you know, and that kind of stimulated your taste buds, and then you ran to, you know, because you never got snacks, and, you know, and you were hungry.
Didn't exist.
So I think a lot of people today just don't even know what it is like to be actually hungry.
Yes.
And what that, so, you know, in our program, we hope to educate right from hunger scale to what you said about how to shop, how to read labels, how to cook, how to enjoy chopping your vegetables to the correct size, and, you know, being in the zone, giving respect to food, which is the basic ingredient. In fact, when I say this to people, you know, whole food, plant-based, cook your own food, they say, Dr. Sonu, can you just cook it for us?
Well, I mean, that is a possible thing to do, is to be able to buy ready-made meals that are
so you know, that's
wholesome.
something that, you know, I've taken on board, because, you know, your patients inspire you to say, okay, well, this is what they need, and the idea is that you take them along a way, get them to experience it, and then hopefully that'll inspire them to learn how to cook it themselves and introduce it to their families, and you know, like you said, we've got to eat as families again. You know, now I would have two members eating some other, one eating Thai, one eating American, one eating, because that's what they want to eat.
Yes.
And you don't eat a meal together. And I think that's really important. We've lost the whole connection with food and all of that. And I think there's so many fads and diets. So it's almost... It's too hard to undo.
Yeah.
It's almost like you can't keep up with what's the next diet on the popular, you know, media. So tell me about, how do you cook? What is it that, you know, if you had to give advice to a busy, you know, mum that you are, and what would you say?
How do you produce a lot of food quickly when you're tired and all you want to do is just sit down and relax? I think what I used to do when all the kids were smaller was I used to prep all the food on a weekend. So I would I used to make like a fresh tomato sauce, and then I would cook maybe a lot of potatoes, just have basic ingredients but already partially cooked or completely cooked, and then I could use whatever was there when I'd come home from work, and I could throw that together in a meal quickly.
Yeah.
And I think that's one of the keys. I mean, the next step on from that is to actually do a complete meal prep where you box it all up. And that's really what we do in our household now, because everyone needs food to take to work, or, you know, they're coming home late, and we just have lots of meals done in boxes in the fridge. And if you want to eat at 9 o'clock at night because you've been at work or something, you can just take one of those meals. But they're home-cooked meals.
Yeah.
And that works really well. And you can do that on a weekend, and you can do it relatively fast.
Yeah.
And if what I sometimes do with the kids is we share that process. So, you know, my oldest son, he'll do the curry and rice, and I'll do an Italian-based thing. One of the other kids will do Mexican.
Yeah.
So plant-based diets are good because you can utilise any cuisine in the world.
Yes. And so throw in the similar ingredients and
that's right.
Yeah.
It's just by the different flavours and things.
And when I went to Pritikin in Florida, one of the most famous lifestyle retreat programs, they've been running since the 70s, and the executive chef there was working for one of the largest typical American food chains that serve like meals with like a kilo of cheese on top, and now he's a Pritikin executive chef. I mean, they treat and cure heart disease and blood pressure and obesity. And Nathan Pritikin was actually not even a doctor. He was an engineer who was diagnosed with heart disease. And then he decided, well, I'm not going to take what the doctors are saying, that's it. Wait for your heart operation. Don't exercise. He just wanted to find out how he can reverse his heart disease through food. So he started researching it, and he realized that actually plant-based food with low salt, low sugar, low fat is what cures your heart disease and helps you lose weight. And that's what he did. So the executive chef there, who I had the opportunity to learn from and be at that program, said to me, the amount of salt that I used to put in one meal when I cooked as a commercial chef for one of those food chains is 25 times what I use in my meals for the whole week.
Yeah, it's horrifying, isn't it?
And you just think, and salt is what makes food tasty. Mm-hmm. It is addictive, and
it also stimulates your appetite.
It stimulates, and
so
when
you want more.
Yeah, you want more. You lick your fingers. You lick your. So
I'll have some more chips. Yeah. It's bad.
So it's and that's why eating out, is really really hard. But what they've done, and this is something I want to incorporate in our program, is they would have. How we carry these allergy cards. Look, I'm allergic to prawns, so don't serve me prawns. So people who are now inspired to eat healthy, to not have salt and sugar and fat in their diet, could take a card to say, hey, I don't want to get heart disease and blood pressure and dementia. So could you cook my food without all these added ingredients? And they literally take that card to the chef. So I think that's, to me, was revolutionary, because like you said, we are who we are. We're going to want to eat out and have that experience, and there's a lot of social aspect to it, but we can still change what we're eating. And it's all about, it's the industry. If that's what people demand, then that's what they will cater to.
That's right. And you can see a little bit of a shift occurring in some restaurants. With
the sauce on the side and...
Yeah. And it's not hard to do. It's actually quite easy. And to eat food that looks more like its natural state.
Yeah.
What's nicer than a nice big plate of broccolini with a few little almonds and stuff on it.
And I think that brings me to a very important point, that good food has to taste good.
Yes.
Because there's a misconception that it won't be good. So, it won't taste good, or I won't enjoy it. And I say, you know what, I never eat untasty food, but it's good for you. Right. So I think that's, again, a misconception. But you've... I've tasted your food, and we've cooked for each other many times, and I'm learning to also adapt my recipes, and that's the other thing. You can cook differently and still work with the concepts and the ingredients. So, for example, there's a study that shows that if you eat white rice, it increases your risk of breast cancer, whereas brown rice decreases your risk of breast cancer. It's both rice, but one is processed food and one is whole food. So the whole philosophy of our program is about whole foods. It's about how Mother Nature intended it. And I think you're a big promoter of that. You'll do your steel cut oats and...
But I mean, to me, if you sit down and eat a big bowl of vegetables, you actually feel good after that. Whereas if you go out to a restaurant and have one of their heavy, pastas with too much cream sauce on it or whatever, afterwards you don't feel so good.
Yeah.
You know what I'm saying? It's and also you get, we call it in our household the food coma effect.
Yeah.
So when you have these meals where you absorb the carbohydrate component too quickly, it pushes your insulin up high to try and control the blood sugar, and then the blood sugar swings down low, and then you go... Everybody knows what I'm talking about.
Yeah.
They just don't understand the underlying physiology why that actually occurs. And it's because you just put this huge load into your digestive system of what I call fast carbohydrate, which just gets absorbed too quickly, too much blood sugar, and it puts you to sleep.
Yeah.
And, you know, for most of us, we don't have time for an afternoon nap.
Maybe in a few years when you retire, there's still hope. So coming back to your patient in your clinic, you know, with the diabetic eye, and you would say to them to get their diet and lifestyle sorted and keep an eye on it. And
well, I can be quite blunt. Sometimes you need blunt with people, I think, because they don't have a perception that they're overweight.
Yeah.
And that's really the most important thing, is to indicate to them that they're actually
Do you think
fat.
we're at fault that we don't say it as often?
Well, it's become politically incorrect to say it. That's the problem, to use the fat word.
Yeah.
I mean, when I was at school, fat kids were pretty rare. Very rare. You'd be lucky if there'd be one kid in the whole school that was fat. Everyone else was skinny. But now there's so much political correctness controlling how we present information to people. And I think that, you know, sometimes you do have to use that F word. Just say
We're
fat.
back to the F word.
We're back to the F word. Just say, what are you doing about your fat? Like,
and do you think it's a generational change
Yes.
amongst doctors, that we're just kind of beating around the bush and we're not?
I think so.
Yeah.
Yeah, and I think they're trained that way as well. They're trained to be very culturally aware and very aware of how they say things, that they're working in a politically correct framework all the time. And I'm not saying, I mean, obviously when we're doctoring, we are doctoring to an individual. So how you present information is based on who's sitting in that chair.
Of course.
You don't just present it in the same manner. And some patients, you also need to pitch what you're saying at their level. So if you have a doctor sitting in the chair, you will pitch it at a very different level to if you've got, for instance, someone who left school when they were 15 and may not have good academic knowledge.
Yeah.
So, but at the end of the day, I think with obesity, everyone understands the F word. They do.
Yeah, look, I agree. I think our intent should be cure. Our intent should be reversal. Our intent should be changing that trajectory. And that's what I want to promote in my career going forwards. And it's such a pleasure to hear it from, you know, experienced clinicians like yourself. And let's put that slogan out there that we do see it, and we just need to give that baton back to the patient. And that's why it's called your life script. It's not mine as your doctor.
That's right.
It's your life script. And you've got to start with why you would change, how you would change, and then how that would change the trajectory of the diseases and health that you ultimately have. So that's a good segue to wrap up and maybe have a cup of tea. And thank you.
To me.
Thank you for coming. Thank you for coming and sharing your expertise, and it's an absolute pleasure. This is Dr. Sonu signing off your Lifescript with the lovely Pam. Thank you for tuning in to the Lifescript podcast. I hope you enjoyed today's episode. The show notes and any resources mentioned can be found in the accompanying blog post on my website. Please remember that the information provided in this podcast is not intended to diagnose or provide medical advice for any health conditions. If you're looking for individualized support, please head over to my website, drsonu.com.au. That's drsonu.com.au to learn more about how Kirin Wellness and its programs can help you on your health and healing journey.